So welcome everyone. We have hit 12 o'clock. This is the Collaboratory for School and Child Health's Whole Child Well-Being Advancing Research and Dissemination in a Policy and Practice event. We are co-hosted today by InChip. And I want to welcome everybody for taking an hour of their days to join us to talk about how to bring research into a policy sphere, which is something that we talk a lot about, but maybe we don't spend enough time really unpacking for everyone. The Collaboratory for School and Child Health's mission and goals are up at the top of the screen, or at least our mission is. I want to take a quick second and just acknowledge our founding co-directors, Carol Proliferoni and Sandy Chafulias. I am Dr. Beth Russell. I'm an associate professor in human development and family science, and Sandy's newest co-director now that Carol has stepped down from her formidable role. I have big shoes to fill. So Carol, if you're here today, it's great to see you. Today's event is going to focus on 2 of our 6 goals. The first of which is around disseminating evidence. The second of which is around how to explore, evaluate, and advance policy. So fortunately, we have a pretty formidable panel joining us today. First, I'd like to welcome Jamie Foster, Connecticut State Representative. Jamie Foster is serving her first term as a state representative in the Connecticut General Assembly from the 57th District and currently serves on the Public Health, Energy and Technology and Children's Committee. Prior to being elected to serve in the General Assembly, Representative Foster served in the Ellington Human Services Commission, Board of Education, and the state's Milk Promotion Board. She earned her doctorate degree in nutritional sciences from UConn and is a registered dietitian and currently works as a research scientist for the Yale Griffin Prevention Research Center. I'd also like to welcome Preston Brittner, professor here at UConn in the Department of Human Development and Family Sciences. Preston Brittner is professor and associate department head for graduate studies in the Department of Human Development and Family Sciences. He is interested in the application of developmental research to child welfare and primary prevention settings. Much of his recent work centers on family-focused, community-based prevention programs. He has also taught extensively about how research findings can influence policy and legislation through science translation briefs. Finally, please join me in welcoming Sally Mancini, UConn Rudd Center for Food Policy and Health. Sally Mancini is the Director of Advancing Resources at the Rudd Center. Her role there is to inform the public, community organization, advocates, and policymakers about the center's research and help state and local advocates develop the resources necessary to support food policy. Welcome everybody to today's panel discussion. Let's go ahead and begin. I'm going to stop sharing my slides. Hopefully, oh, look, all those faces. Hi, everybody. I wanted to start with a quick question for everybody. Part of what we'd like to discuss today is what is effective in terms of communicating research results within a policy sphere. We'd love to have you give a short intro about yourself and your experience in this intersection space of research and policy. Representative Forrester, since you're first on my screen, can I start with you?
Sure. So I have a lot of experience prior to becoming a legislator trying to disseminate evidence-based nutrition information in the anti-hunger space. And so for folks who have never done that before, a good place to get started is an advocacy group related to your organization. So I spent almost every year throughout my master's and PhD program going to the Anti-Hunger Policy Conference, which works with people who do state and governmental interventions, academic partners, and advocacy groups alike. And we would go for an advocacy day at the Capitol. And someone who did advocacy work would schedule for everyone to go together and to have conversations with our congressional and Senate delegation in Washington, D.C. I think that's a great place to start. The first time you go, you don't need to know what you're going to go and do and plan and say. You could just bring all your expertise, your wheelhouse with you and follow suit with other folks. But I also think that it's really helpful to learn a little bit about how things work, which is how I got involved in my local town and organization, and realized that there's actually a lot of change that you can have in your municipality using your expertise to disseminate information. All those experiences shaped how I communicate to other policymakers and people who make policy decisions. I think that dissemination of information could be simplistic, but I think a lot of times it's building rapport with people who are making decisions so that when they know, I want to address hunger in my community, the person I'm going to talk to is the Red Center or Dr. Foster. And I'm going to have those conversations with that person because I'm thinking about anti-hunger advocacy, and I know that the experts with relevant expertise are in this place or is this person. So I feel like a lot of it is relationship building. I'm sure there are other things that I can talk about too, but I feel like that's a good intro.
Oh, that's great. Thank you so much. Sally Mancini, you're next on my screen. Can we turn to you?
Sure. Yeah. So really happy to be with all of you and on this panel today. My interest in policy really started way back in the beginning of my career. I was an AmeriCorps Vista volunteer in Willimantic, and I was implementing a program to help individuals save towards homeownership, small business development, or education. And I would meet with families in this program, and I'd hear the same struggles that they were having with benefits, primarily SNAP benefits and TANF. And I started thinking, well, I'm individually talking with folks about their issues, but this this program needs help. It needs policy. It needs change at the higher, more broad-based level. And I really quickly, after my year at AmeriCorps, realized I want to do policy and advocacy work, and I want to dedicate my career to it. I was fortunate enough to be hired by End Hunger Connecticut. And although I was hired initially under a food stamp outreach grant, I was able to transition my work to policy and was a lobbyist with End Hunger Connecticut at the state level. Ended up later in my career also working for a lobbying firm representing a number of different clients on public health, health-related interests, and really brought all of that to my role at the Red Center.
Well, welcome. Thanks for joining us. That was a great intro. Dr. Preston Brittner, you're last on my screen. Welcome today.
Thank you. I was born in DC, and I think the policy bug bit me early. It was hard to escape it. And in graduate school at the University of Virginia, in my psychology program, I was trained as a developmental psychologist, but I also completed the community psychology curriculum and did a lot of policy relevant research on things like child maltreatment prevention and childcare policies. And so I wound up testifying at the Virginia General Assembly and doing briefs and that kind of work as a graduate student. So when I came here 25 years ago as a new assistant professor, I knew I wanted to do research that informed policy that made a difference in the real world. The Human Development Family Sciences program was a really good fit for that kind of work. So I got here, I introduced myself to the leadership at the Department of Children and Families. As soon as I got here, I said, this is what I do. To Representative Foster's point, I tried to establish, here were some areas of expertise that I had, and that I was at UConn, the state's land grant college, and that was part of my mission, was to try and help solve problems in Connecticut. And that really began 25 consecutive years of me partnering with DCF and other state agencies to do policy relevant research. Not just, and we'll talk about this, not just take research that we're doing and then translate it, but really to have that be part of the formulation of the research from the beginning.
Thank you. Welcome to you as well. That's actually a really great lead into our first question. Our first question is for Representative Foster. How are some ways that people have gotten your attention with research, or what would you recommend that people do in terms of getting an issue before the legislature?
Well, I think a lot of this starts with understanding what the legislature can work on and what they are working on and how that is relevant to what you're doing. I think that a lot of times folks testify before a bill that's of interest to me, and then I know that I can go back to them, that they've left some sort of impression on me, and so I'm going to follow up. So there's two groups that I think are helpful that are already sort of forming these conduit relationships with people. So the Scholar Strategy Network, Dr. Raysan runs at UConn. I've often times when I've run up into an issue where I feel like there's an academic who knows this. I don't, and I should ask someone about it. I will try and move through the Scholar Strategy Network to try and find someone who can help. When it comes to testifying before us and speaking, I find that lots of academics don't do it. There are lots of times that there are bills before the General Assembly that people are, acclaiming as an evidence-based policy change. And then I sit there in public hearings and think, if this is evidence-based, whose evidence drove this? And where are they telling us, are we doing this right? Because very oftentimes, I think legislators without academic backgrounds, which is, to my understanding, everyone besides me, there's 2 MDs in the General Assembly, but no other academics. A lot of times we're sitting there in bills and then they say, oh, and this is what the study found, and it proved X, Y, or Z. And with that proof, we're running this thing. And I'm like, this doesn't sound like this was something that an academic really guided and spearheaded. So I find that a lot of times the academics disseminate some information, it gets to the news end of things. And then oftentimes legislators are making decisions after that portion of things. We have some really great, strong science-based legislators in the General Assembly who really understand things, but I do feel like lots of legislators' attention is grabbed by the news. And so having folks who are disseminating information to the news is important. At the Rudd Center, they're really strong on that. Lots of the information that academics are producing is getting picked up by mainstream media, and then it's being disseminated because most of us, most legislators are reading the news every day. We're watching the news every day. We need to know what's happening with current events, but that means when information is being shared based on research, that's helpful. I think every academic who wants to influence policy should understand what committee of cognizance is related to their work and work on relationship building. So what that means is the committee of cognizance oversees the state agency that relates to your field. So if you're interested in psychology, you're probably looking at the Public Health and Children's Committee, maybe the Education Committee too. If your expertise is on energy policy, which if that's the case, please reach out to me because I'm trying to find you. If that's the case, then you're talking to the Energy and Technology Committee. If your expertise is on nutrition and obesity prevention, then you might want to talk to the Human Services Commission because they oversee SNAP administration at the state level. So you have to figure out who and what that is. And I think that's easy enough to do if you reach out to your legislator and they'd probably be able to steer you. But you also should probably know who your legislator is. And then if you're the expert, I think you should feel comfortable going straight to the chairs of committees and having conversations with them as an academic. Don't always feel like you have to go through your legislator because your legislator's passion project might not be the thing that is your expertise. I try and make sure that anyone who comes to me who has expertise, I'm also working with directly if they're related to my committee of cognizance. Typically, I prioritize in-district work, but if someone's expertise helps my district, then I spend a lot of time there too. So I hope that comprehensively answered the question. But I think starting with the conversations is really helpful, and it takes time, but I think it's really important.
Yeah, I definitely am grateful for your guidance around doing both the front end networking, the relationship building, but also a bit of the mapping activity about what's the path to the most efficacious platform to have those conversations. Any encouragement to go ahead and shoot for the chairs of those committees. That's really helpful. Thank you.
Yeah.
Dr. Brittner, what are some of the ways researchers can communicate and engage with policymakers?
Well, I'll mention that I have a class that I teach in HDFS at the undergraduate and the graduate level on child welfare, law, and social policy. And I created that class when I first got here like 25 years ago. And what I have them do in the graduate version of that class is write a literature review, a critical analysis of what works and what doesn't work on a particular relevant area. So therapy A works, therapy B doesn't. their PC is indeterminate at this point, and be ready to talk about the science there. So as our representative mentioned, like how good is the literature on something. Then I have them write the 3 to 5 page policy brief as if they are writing to the DCF commissioner or the Committee on Children at the legislature or whoever the relevant group is, speaking to ideally a pending policy or a pending bill. And so page 1 is, here's who I am and here's my expertise. Here's the issue before you. Then you've got about 3 pages to take the jargon-free version of your 15-page lit review paper to just hit the highlights. And then page 5 is, therefore pass the bill, therefore don't do the policy, or it needs these tweaks. And I realized that when I actually go to Hartford, that my policy brief is 2 pages instead of 5. But from an academic exercise, that's what I have the students do to become expert and get over their imposter syndrome and feel competent, and then have to whittle it down to what is really important. And then finally, I have them do the 3 or 5 minute oral testimony version of that, so they're comfortable speaking at an even keeled pace and trying to convey what the important things are. So that's what I do in the classroom. And I actually offer very similar advice to researchers at various levels seeking to make a difference. Like, get your stuff together, really know the topic, and then be able to do that translational work that's a little free of jargon and that ends with a recommendation grounded in the science rather than further research is necessary, like at the end of every journal article. So I'll stop there.
Yeah, I definitely hear your themes around weaning ourselves from jargon, speaking plainly, but also doing so quickly, right? Concision being a key feature of how to communicate in this space. Sally Mancini, I wonder if you might be able to build on what Britt was saying about building a brief to talk a little bit more broadly about what types of dissemination do you find to be the most effective?
Great. Yeah, thank you, Britt, because I think it's a perfect segue into it I wanted to share. I think when determining what dissemination strategies are the most effective, you really need to think about 2 factors, your audience and the timing. So you need first to decide who your primary audience is when you're disseminating research. In this case, we're talking about policymakers. And so a brief or a fact sheet is probably the most effective. But in other cases, it may be a different audience. But being strategic and thinking through who is my primary audience here, and then targeting your dissemination towards that audience is really important. And then the timing, considering, is this issue already garnering news attention? Is there another timely event that I can latch on to that to share information with the news, with news outlets or the press? Or do policymakers need this information quickly since it could influence legislation, regulation, or administrative action? And to be able to answer all those questions, I think it does take relationships with folks at the state level or the federal level or even the local level of government, whichever policies you're trying to influence. And so having that context, knowing what's happening, understanding the timing of things is key to making dissemination effective. I just want to share a quick email I was recently sent by an early childhood advocate because it impressed upon me the importance of translating research into different materials that are easily understood by a variety of audiences. He said, "I see that you have a new report out. I looked at it long enough to see that it's a typical academic report for journal publication and had the usual non-academic reaction. I don't really have time right now to sift through all of this to see what, if anything, is important it's trying to tell me. Is there a plan to summarize it for policymakers and childcare providers that will put the important stuff or recommendations for change into plain language?" And that's what I encourage us to do in our research dissemination. Plain language, as Britt was saying, no jargon, and that so what piece. Yes, this is research. It's really well done. The methodology is sound. But what can I do with this as a policymaker or as an advocate? How can I use this to make change for the better? So I think I'll stop there.
No, I think we're starting to get a very clear sense of how researchers can start to develop new habits, both in their relationship space and in their communication space, that'll be particularly effective when communicating with the legislatures. I want to point out that we do have another event coming up. I'll share some information about it at the end of our panel today. We're going to be working with the Scholar Strategy Network that Representative Foster mentioned just a minute ago to take this a step further and talk about how to create some policy maps. But I thought maybe next, Representative Foster, if we look at this from the other direction, you mentioned it a minute ago, how do state legislators, including yourself, find and access research on topics of interest? So not when the researchers are coming to you, but what are the paths that you use to find new pieces of information as you're putting together your arguments or your positions on things?
Well, I would say, one, I'd make sure your bio on your university webpage is up to date. I think that's a good place to start, because oftentimes when people come before us to testify, I'll say like, okay, let me just understand what their sphere of reference is and check that way. And sometimes I'll search like the UConn or the Yale or the Trinity website and look for something in particular. So one of the things that I have been trying to do for a long time is develop a policy impact pathway for the Energy and Technology Committee. So I do feel like in the public health sphere, because my academic career is it was at UConn, I felt like I had a lot of connections. If I don't know someone right away, I will shoot a message to Dr. Gorin and get an introduction. And that's how I met Sandy. And so those kinds of introductions have helped me. A lot of times I've needed something, I'll go to the director of a department that is relevant to what I'm looking for. I have not been able to find an academic to bounce ideas off of in the energy and technology sphere and space. And I have tried those same methods, reaching out to department heads in university systems and trying to get someone to tell me, we either do or we don't do this thing. And here's how we can get help. Many times, a legislator will use their outreach team. So we sometimes will have someone who helps us do outreach and events that'll help us glean information relevant to our community. And my outreach coordinator would reach out to CCMC or UConn, a relevant department, and say, Rep. Foster wants to do a community information forum with someone from your department who has relevant expertise. And so we'll do a community conversation that'll allow my constituents to have an opportunity to engage with both me as their legislator and the person who academically would say a policy like that might or might not work, and here's why. And that way I can go into session, and I do this mostly during the off session. So between now and May, most of the things are sort of before me right now, are already decided. But come May, when the session ends, I will start preparing for the next session, which means I'll try and have these community conversations. There's an issue a constituent raises to me, children's mental health. That's something we're talking about right now. So I'll reach out to Dr. Gorin, get a couple of introductions for people whose expertise is relevant, and have a community conversation. And then I'll make sure that those community conversations and the ideas that are gleaned from those are carried into our legislative team that is drafting and writing the bill. And so those kinds of conversations will shape the way I move through the process. A place that's really important for me is when I reach out to an academic person, they'll share me a resource oftentimes, but writing policy and influencing policy or informing policy is about a whole lot more than saying, like, here is the best. A lot of times, a bill will be a lot more complicated than that. So a good example of this is the flavored tobacco ban. That's a bill that is very popular, and it was voted out of the Public Health Committee. It came very close to being included in implementation language last year, but didn't get passed in the end. lots of folks are advocating around that bill, and the academic voices around those differentiate quite a bit. And a lot of people are presenting themselves as academics when they are less so academics and they're advocates. So I would say the academic voices need to come up and sort of sift out and talk out, okay, well, if this person's telling me X, Y, and Z, why isn't that true? And policymakers need to be able to ask questions and have conversations about it. So I think that email that Sally got is really interesting. That's like, give me the condensed notes, tell me what to do. But once you're doing that, if there's pushback, you need to be able to talk that out with a policymaker too. So having someone who will have like a bidirectional communication with you is important. I don't know that every policymaker will do that, but chairs very often will. And people whose expertise and passion topics will. And so finding the right person to talk to about an issue is really important also. But I really do go to department heads often or government relation teams. So at UConn, Joanne Lombardo and Gail, I talk to them pretty often. I would say like probably every other week. And sometimes I'll say, I don't really know the person who's doing XYZ, crumbling foundations research. And they'll be like, oh, well, we know exactly who to talk to on this topic. And they'll make an introduction. So I would say too, making sure that the people who are connected, who do policy advocacy at UConn know who you are and what you do, if you think your work would inform policy. But those are the general paths that I go through. Sometimes it's just looking through bios, or I'll do an academic search and say who in Connecticut is doing research on this topic, but I don't think that that's every other policymaker. So I hope that answers the question, and I'm happy to talk more.
Absolutely. We only have a couple more structured questions, and then I'm hoping we'll move away from the sort of prefabricated framework for this early portion and move into more of a conversation amongst the panelists and to invite the rest of the audience to chime in as well. Dr. Brittner, building on what Representative Foster was just talking about in terms of identifying where they can come to ask questions in terms of seeking input from the academic community, how do researchers then identify their opportunities to share findings? What would you recommend we do to get a better sense of the timing issues that we were talking about a minute ago, or even the point of contact theme that's also started to emerge?
Yeah, well, I think she just gave us a couple of ideas of keeping websites up to date. When I used to edit the Journal of Primary Prevention, I forced authors into writing a strategic implication statement that went into the abstract to say what policy audience should be reading this and what's the take-home message. So I think doing some of that work is important. Lots of times I just get approached and, the Senate president asked me to co-chair a status offender advisory task force at the legislature, and that turned into 4 years of work at the legislature. So lots of fun. But so sometimes they just find you. At the national level, I don't get a lot of calls from legislators, but I get calls from Health and Human Services or the American Psychological Association saying, we've got a congressional briefing on family homelessness. Can you come and speak to the work you all are doing in Connecticut around housing and child welfare or something like that? So sometimes it's just being willing to answer the calls and put yourself out there. Obviously, you can track, if you care about a particular issue, you can track bills in your favorite state legislature or federally with keywords and just be aware of that. And then, again, reach out to legislators, either using the tack of they are your representative or they're on a committee that would want your expertise. And sometimes that's sharing of a brief. Sometimes it's a Capitol Hill visit, to a relevant office to get that in front of them. I would say at the state level, if you're aware of federal funding opportunities that might bring money into the state, and that we have the possibility to run a new program or to study a program effectively, a lot of the state agencies are very receptive to bringing in evidence-based programs or just bringing in money. So I think there are a lot of ways to get engaged.
Can I ask you a quick follow-up? let's speak to, let's say, a more junior scholar or someone who's maybe for the first time reaching into policy space. They want to try and do a search to get a sense of what are the issues that are coming up. You mentioned, keeping track of keywords. Is that just as straightforward as keeping track of what's making it into the news media, or what are the venues they should be searching, and what are any tips you might give about effective keyword searches to track what's coming up?
Yeah, I mean, I actually was talking about like the bill tracking capacity at the Connecticut General Assembly, for example. So just, you're interested in kids as witnesses or child custody issues or food and nutrition issues, those kinds of places to see what's percolating at the General Assembly. But yes, also other approaches.
So in that case, you're talking about searching Connecticut.gov, like.
Yeah. I had been thinking that way, but obviously you can be looking more generally at news sources as opposed to scholarly enclaves.
Yeah, I think it's important to acknowledge that the timeline for academic publication is so long in most instances that the research we are currently doing, or that might be timely for a given bill that's coming up, may have been done 2 years ago. And so if there's recent findings that we all have that we can be writing into a brief, or trying to have conversations with legislators about before they make it into publication, that might be the most timely approach, right? Doing an academic search means you're looking at things that have been in the pipeline for as much as 2 to 3 years, sometimes longer. Thank you so much. That was really helpful. Representative Foster, I saw something in the chat. Let's see if I can grab it real quick. On the federal level, there's typically a policy analyst in each office that has cognizance over what federal agency that is related to your work. I would try to figure out who that is in your senator's and congressperson's office. Great tip. Sally Mancini, what are some of the barriers to disseminating research? I think we've talked about timing, we've talked about brevity, we've talked about language. Do you want to build on any of those, or is there anything else you'd like to talk about?
Yeah, I would just say I want to pull out something, and Jamie did allude to this earlier, but the decision-making processes for researchers and policymakers are just very, very different. We know researchers rely on studies and they're testing these specific hypotheses systematically. And many policymakers say they want to promote evidence-based policies, but their interests are typically much shorter term. They're concerned about re-election, and they have to meet the needs of a variety of stakeholders. And in reality, at the end of the day, most policy decisions are often the result of compromise. And so it's being able to navigate these two very different decision-making processes and navigating it successfully in a way where you're constantly able to react and respond. Which leads me to another barrier, I think, is it's a lack of funding for public health policy and advocacy to support this ongoing dissemination and relationship building. So many of our public health programs are federally funded, don't allow for this long-term ongoing relationship advocacy that's needed to build up the science and the evidence in a way that policymakers are saying this is what we need and want when we're going into the policy development process.
I want to maybe ask an extension, or maybe we'll talk about this as a larger panel, but also one of our audience members has put something in the chat to me mentioning that, in fact, getting a legislator's attention can be very difficult, in part because of the scarcity of funding, in part because of the evolving nature of the conversations that they're having. So I wonder if we can, maybe Representative Foster, how can we strengthen our outreach? How can we do better with our messaging to be succinct but maximize on the limited attention span of our legislators? What can we do to better our outreach?
Well, I think understanding what a legislator does on the Connecticut level is really important. So we have a part-time legislature, which means we're in session in a short session, which is the even month, from February until May. And in the long session, it's January to June. But that is a really small window of time to do a lot of really important work. And so things come in really, really fast and furious in that window of time. If something is really important to you to advocate for, I really recommend that you work with your legislator and the legislators who lead the committee that's relevant to your work in the off session as early as possible, and give them an idea of what you're working towards, what you want, and what you recommend before they are like frayed and pulled in a million directions. The nature of a part-time legislature is that most of us have other full-time jobs. And so it is really helpful to me. I think this is like Sally got an email saying, I don't have enough time to read this report. Tell me what to do. I think that's what a lot of legislators are looking for. Also, if something is an academic styled report, not every legislator has the skills to sift through that and say, okay, here's my action step from this document. And I think for that reason, there's a lot of times people who are in advocacy organizations that are non-academic, who the way they speak to legislators is more accessible. And so then they get leaned on more heavily. So if you think about the folks who are doing advocacy around smoking cessation, the academic people who have a nuanced message, who say like, there is probably a place for a electronic cigarette cessation program. I'm so sorry. I just fell off of my solar panel. There's room for where, a smoking cessation program that some flavored tobacco products work, but not in every arena. That nuanced message, what does a legislator do with that? Like, where do they go? What do you want them to do? Whereas an organization like Tobacco Free Kids is like, ban it all. And that's a lot more actionable. And so when you have scientists who say our research is a little bit nuanced, and so there's no real perfect solution, most legislators want you to say, like, here's what you do and it'll be perfect. Like it's going to be better. And I'm not saying like make your research all or nothing, that it's like a perfect solution. But I think you have to understand that there might be people who are advocating in a different direction than you, who appear similarly credible, but who have less nuanced messages in what they're advocating for. And sometimes that becomes more accessible to lean towards. Also, it might not always be the legislator that you want to talk to. So we have an Office of Legislative Research at the Capitol, where there are librarians and staff whose job it is to write briefs for legislators on policy. And so there might be a policy brief on diabetes prevention programs at the state level. And what that policy brief comes to is probably going to be a summary of what other states have done. And it might not include the early academic information, but that might be information you want to share with that group or make yourself accessible to that group as well. So I would say don't always feel like you have to go just to the legislator also, that there's professional staff and agency staff that's relevant. So it sounds like Dr. Brittner speaks to DCF directly. I think that's a really good place to be, because oftentimes we take advice from the skilled permanent staff who works for the state all the time. The Department of Public Health might have someone who does something similar to you. I recently spoke to the new director of the WIC program at DPH. And so those permanent staff members, if they're accessing you and they're interacting with you regularly, you're going to get your information to the legislator through a different way. And they probably have a little bit more bandwidth, particularly when I'm in 24-hour public hearings one day on a single bill. So their bandwidth might be better.
24 hours, huh? Wow. Yeah.
It's been a few of those.
Being succinct is important. Yeah, Sally, please jump in.
Beth, I just wanted to jump in with a few things that came to mind as Jamie was speaking. I think in addition to all of the folks that she mentioned, it's really helpful to build relationships with staffers, especially at the federal level and even at the state level. You can email them and get information that you may not be able to get as fast from a legislator. So building relationships with staffers is key. And then also the executive branch. We've done work with the governor's office on sugary drink taxes over the years. So not forgetting the executive branch when you're looking at disseminating your research, because that's another key piece in the whole policy development process. I worked on a bill earlier in my career. It was a bill to ban soda in middle and high schools. And the second year the bill was introduced, it had the backing of the legislature, made it through the House and the Senate, but the governor vetoed it. And so then we were back to square one in the third year. So it's always really important to remember that executive branch piece too. So I will stop.
So actually, we've reached the end of our sort of structured questions. I want to go ahead and open up the floor to more of a conversation with our audience and between each other. If there's something you'd like to follow up on, let's be a little bit more informal now. Let me make sure I can see my full participant panel. And if anyone has any questions from the audience, please feel free to either just raise your hand or unmute yourself and throw them out to the panelists.
Hi, Beth. I have a question. This is Christina, and I'm in nursing.
Hi, Christina. Welcome.
Thank you. I have a question because, for instance, like Brett was talking about working with, the Department of Children and Families or DCF Child Welfare System. And I think it's a good approach to really be involved with the stakeholders and the legislators, because you really get to understand how they function and the things that they're looking for, and then they can understand some of your goals and your aims. But I am just trying to still figure out, what is the best way to be at the forefront, to be involved in like meetings or task force and a committee, like things like that, so that you're not just like in the background doing the work and trying to reach out to them, but you're actively involved as you're doing the work.
I'll answer that because I think one of the really great ways is to get involved in committees that have appointments, but that means you need people in leadership positions know that you're willing to be appointed. And so usually that the legislature will have a list of vacancies, and the minority leader, majority leader, and president or speaker of the House will have appointees on commissions. And so making sure that your legislator or someone who you know who would be your ally and advocate knows that you're willing to be appointed is important. I served on the statewide milk promotion board, which is a position meant for the way it's written into statute is a statewide anti-hunger advocate. And so I got that position. And then when I left that position, they asked me for suggestions for appointments for a successor. Now, the majority leader or the Speaker of the House, whoever has those appointments, might not be looking for appointing someone themselves, but your local legislator knowing what you're interested in doing, that you're willing to serve and step up is really important. But then please be there because there have been occasions and times where there have been academic folks who are on appointed committees and commissions that I'm on. If you end up teaching during the time that meeting meets, and so you'll never be able to be there for 6 months, it's a good idea to turn it over to someone else. And keep that in mind, because sometimes these appointments take a really long time. And so just bear in mind that, like, if you're going to be the academic voice and then you're not there, all of the other voices will share the consensus. It'll look like they had an academic voice there informing what they did, even if that wasn't the case. So I'd say make sure your legislator knows who you are and what you're interested in doing in service. When I first got on, I said I knew some people who were interested in getting involved, and I asked what task forces had vacancies from the majority leader's office, and I got a list. And I looked in, seeing if there was anything that sort of aligned with people who I knew were leading experts.
And can you speak to a bit that you said about the scheduling? How far in advance is the scheduling available so that someone could make a guess about their availability? Or is there a particular person they should reach out to inquire about the posted schedule for a series of meetings?
Some of them are posted and haven't changed for years. So like the Food Policy Council, I think, has been meeting at the same time for like a decade. So that'll never change. But some of them can change based on the makeup of a group. So it depends on what the commission is, and what they're doing and what their meeting schedule is like.
Are they typically fixed for like a session or a year, or do they change?
I think sometimes that's the case, but I think very oftentimes they are like, they'll be standing at that time during business hours, typically, because they have to be staffed by professional staff at the state, and they'll be standing at that time for the duration of however long that group is formed for. So there was a special group on holistic child health that was formed this last session, and it was a 1-year long commitment, and that was the length of time that the committee existed for. I don't know if they'll continue meeting because the statute required them to meet for a year, and that might be it. So working groups depend, it depends on what it is.
I will say, Christina, though, the Families with Service Needs Advisory Board that I got roped into co-chairing, that was 4 years and several thousand hours. So as an assistant professor, you want to be really careful about, something manageable. And I think actually, some of what we've talked about before, which is going to the hearings and testifying on something close to your area and becoming known, is a more bite-sized way of getting out there a little bit.
Yeah, I just wanted to share, as far as timing is concerned, for folks on this call who may not know, is that so there's only one hearing on a bill each legislative session. So if you miss the hearing date, you've missed the opportunity to get face time in front of that committee about a bill. Now, you can submit written testimony and it'll be included in the public record, but that hearing date is really, really important and key. And so signing up for the bill tracking services through the Connecticut General Assembly website, or Google Alerts possibly, or being keyed into a membership committee or a membership organization that's tracking bills that are important to you is going to be helpful to know when these hearings are coming up, and making sure that you've signed up and are on the list. And there is a process for that.
Any other questions from the audience?
So I was looking back through my notes, and something that I missed in one of the questions was social media. And so using social media as a way to share research findings is something that we do at the Rudd Center. We create infographics, very visual pieces that display key findings of the research, and we include those with our social media posts, and legislators do follow the Rudd Center. We can see who our followers are, and so that's another way to get information out in a timely way. Another method that I've seen used quite effectively at points is using social math. And an example of this was when the American Heart Association, the American Academy of Pediatrics, put out a recent policy statement on decreasing sugary drink consumption, and they compared the average amount of sugary drinks that a child drinks on an annual basis to the amount in a bathtub, so 30 gallons. So 30 gallons of sugar each year really hit home, and I still hear that that mentioned in calls, like, children are consuming the amount of sugar in a bathtub every year. We need to do something about it. So trying to make research findings very accessible and understandable to both policymakers and others can be really helpful in dissemination.
Compelling, right? And then
very compelling, yeah.
Yeah.
I also think it's a good idea to reach out to legislators and offer to do outreach events, because legislators are always looking to find ways to connect with their constituents and make sure that constituents know that they are not just pulling things out of nowhere, that I've worked with people, there's credibility to the reason why I'm advocating for this policy in this way. why don't you and me together, constituents and me as a legislator, interact with this academic voice and have a conversation? So I've done those with academics around internet safety. I've done community conversations around mental health in school-based setting and COVID transmission and masking policies in school. And so all of those sort of conversations, if a legislator in your region, even if it's not your representative, if there's a legislator who might be looking to do an outreach event, establish yourself as an expert. Say, if you ever want to do an outreach event, I will hop on Zoom, share a couple of slides, and help people understand why a policy like this exists. That also builds a little bit of groundswell of support to talk to that legislator. Remember that you did this talk and they recommended X, Y, or Z. That would be a really good reason to support this bill. I think oftentimes there are policies that come up in the beginning of session, and then we hear public hearings, and then we're getting towards the end of session, and the bill hasn't been raised on the House floor yet. But if I had a community conversation, I know my constituents cared about it just as much as academic partners cared about it. I will be making sure that any way that I can advocate for that getting called on the floor, it happens, because I want it to get all the way across the finish line.
Yeah, I think it's really important to remember that relationship building is sort of a two-way street. And so thinking about what you can do to get the information out, what you can offer of your time and of your energy in a platform that is valuable to the people the stakeholders you're trying to partner with is essential. So if there is an appetite for speaking to the public about your area of expertise, just being willing to raise your hand and say, this is something I can do, is a great way to express interest in building that reciprocal relationship with the relevant stakeholders. I think that's a great suggestion. Thank you. I see a hand raise. Jessica Geit.
Hi, I wanted to just say how wonderful this presentation is. And I think it's just amazing to get this kind of information because, again, as somebody who's a little bit further in my career, this wasn't really part of my psychology training. And I'm finding it's just so important for people to have an awareness of how this process works and the front end of all of it. I did want to also say that related to having your testimony get in and be able to hit the right timing, I have found personally, and I'm not putting in a plug here, but the Connecticut Psychological Association and other sorts of advocacy groups will sometimes have some resources to have staffers that can help cue you to when those things are. So without having that, I know it can be really, really challenging. But I think that all of the recommendations have been so helpful and so, yeah, just very informative with the process. So thank you.
Yeah, thanks for bringing that up. Brett, go ahead.
I was just going to say that's a great recommendation, and being clear within your guild, right? So, APA is great, but APA only does federal work. They really stay away from state, whereas the Connecticut Psychological Association will do some of that state work. So just finding within your professional organizations the folks who can help you with that and alert you to things, and to share your expertise with them to say, hey, if something hits in Connecticut, I'm happy to go testify or connect with a legislator as well. I was also just going to say on the reaching out side, so we had a federal grant that was looking at integrating housing and child welfare practices, got $5 million from the feds to do the work. We created an advisory board, and we included in that several state legislators and several representatives from executive branch agencies in the state from the beginning to be part of the planning, to have their voices heard, to understand their perspectives, so that when we did the work and then wanted to scale up the program and share data across state agencies, we had advocates with them. So back to that example of networking and the two-way street of the interactions.
Well, and starting a project from a place of open communication with the relevant perspectives. That's a great tip. We have time for maybe one more question from the audience.
there isn't one more.
Take it away. Yeah.
There was a bill, there was a very long public hearing on Friday on an act concerning children's mental health, which is going to be a seminal bill this legislative session. And it's not voted on in committee yet. And so the public hearing has happened. And if you want to sort of flex and see, try this out, I would recommend emailing your legislator on this bill. It's House Bill 5001. And it's a good place to start. It is 100 and some odd pages, but look for the areas that speak about your areas of expertise and try and reach out on this bill, because this is probably one of the most important pieces of legislation we'll do this year. We got a lot of feedback in the public hearing about where to make improvement, but there were 4 academics that we heard of out of 200 and some odd speakers. So it would be great to get more academic people giving feedback to folks. And I serve on both the Children's and Public Health Committee, which are the committees of cognizance over this bill. So if you want help relaying information, you'd rather start with a friendly face, send it to me, but otherwise email your legislator and give it a try.
That is a really helpful, concrete area of interest that I know many people on this call probably share. So thank you so much for highlighting that. We're getting right up close to 1 o'clock. I do want to take just a minute. I'm going to put in the chat for everyone to see our upcoming Collaboratory on School and Child Health event. Hopefully you guys can see that there. Our next event is called Mapping Your Policy Network. It's a workshop sponsored by the Collaboratory, InChip, and the Connecticut chapter of the Scholar Strategy Network, which you heard Jamie mention earlier. The goals for that day are to really help scholars start to appreciate how to understand what the network is, hear specific to Connecticut, a bit about the timing of our sessions, and to give us some concrete skills to understand, as Dr. Geit brought up, on the front end, trying to get an appreciation for the how, the when, and the what of contributing our evidence-based findings into the conversation. You can see that event will be held Wednesday, March 30th from 3 to 4:30. I believe almost everybody on this call is probably an affiliate either of InChip or of the Collaboratory on School and Child Health, so you'll be getting emails from us about that upcoming event. I believe registration is limited. Ellen, are you still with us? Can you confirm? Yes, we are limiting registration for that?
Yes, it's limited to the first 100 people.
So if it's at all interesting to you, I would encourage you to go ahead and register sooner rather than later. And with that, I just want to take a true gracious moment to say my deepest thanks and appreciation to our panelists today. I found this really helpful, and I've been on the fringe of policy work for 20 years. So the concrete suggestions and the reminders of best practice were exceptionally exciting to me. Thank you so much for sharing your expertise, and I hope everybody stays well and has a wonderful spring ahead.